I will be conducting a live session on one of the core mandatory units of NVQ Level 3. This aims to provide you with the style and methodology for answering and scripting your responses. Please prepare your writing materials and pay close attention. You can always replay the video to understand the concept thoroughly before you begin. Remember, you are not alone. Reach out to us if you need support and further guidance on how to approach the various units. Unit 1. Health, Safety and Wellbeing. Answer. 1.1. Evaluate workplace health and safety policies. 300 words. In my role at Sunshine Care Home, I've taken a proactive approach to health and safety policy implementation and evaluation. My comprehensive review of workplace policies revealed several critical areas requiring updates to align with current legislation and best practices. I specifically focused on the Health and Safety at Work Act 1974 and recent COVID-19 guidelines from the Care Quality Commission, CQC. A significant achievement was identifying and addressing gaps in our fire safety procedures. Through systematic policy review, I discovered our evacuation protocols didn't adequately address the needs of residents with varying mobility requirements. I initiated a complete overhaul of these procedures, implementing personalized evacuation plans, PEPs, created individual evacuation strategies for each resident, incorporated mobility equipment requirements, designated staff responsibilities during emergencies, established communication protocols with emergency services, regular policy review mechanism, monthly safety committee meetings, quarterly policy updates, annual comprehensive reviews, stakeholder feedback integration. The impact of these changes was measurable. 30% reduction in evacuation time during drills, 100% compliance with CQC safety requirements, improved staff confidence in emergency procedures, enhanced resident safety awareness, critical learning. During this process, I learned the importance of involving all stakeholders in policy development. By consulting with residents, families, and staff, we created more practical and effective procedures. For example, a resident with visual impairment suggested incorporating tactile markers along evacuation routes, which we implemented house-wide. Evidence. I maintain a detailed policy review log, PRD 2024-001, documenting all changes, rationales, and outcomes. This includes before and after comparison documents, staff feedback forms, resident council meeting minutes, implementation timelines, training records, audit results. 1.2. Risk assessment implementation. 300 words. My approach to risk assessment implementation combines systematic evaluation with practical application. I developed a comprehensive risk management strategy that goes beyond basic compliance to create a proactive safety culture. Daily risk management activities, environmental assessments, morning walkthrough inspections, equipment functionality checks, temperature and lighting monitoring, hazard identification and immediate resolution, resident-specific risk assessments, individual mobility assessments, personal care risk evaluations, medication, management reviews, dietary requirement checks, case study, wet room safety enhancement. I identified increased fall risks in our wet room facilities through trend analysis of incident reports. My response included implementation steps, conducted detailed environmental assessment, consulted occupational therapists, researched anti-slip solutions, developed implementation timeline, coordinated installation work, monitored outcomes. Results: 65% reduction in wet room incidents, improved resident confidence, reduced staff anxiety, enhanced CQC compliance rating, manual handling innovation. I introduced a traffic light system for resident handling requirements. Red, full hoisting required. Amber, stand aid assistance. Green, minimal assistance needed. This system resulted in 40% reduction in handling incidents, improved staff confidence, enhanced resident dignity, better communication between shifts, evidence portfolio, risk assessment documentation, RA 2024-001 to RA 2024-0050, incident trend analysis reports, equipment maintenance logs, staff training records, resident feedback forms, implementation reviews. Remember to subscribe, like, and share. We need to make 2025 work for us. 1.3 Infection Prevention and Control, 300 words. My role in infection prevention and control demonstrates comprehensive understanding and practical application of key principles. I've developed and implemented robust protocols that exceed standard requirements while maintaining resident dignity and comfort. Systematic approach to infection control, daily monitoring and documentation, temperature and symptom checks, PPE compliance audits, hand hygiene observations, environmental cleanliness assessments, staff development, weekly infection control updates, practical PPE demonstrations, hand hygiene competency assessments, cross-contamination prevention training, COVID-19, response leadership. During the pandemic, I implemented enhanced measures, created isolation zones, developed staff rotation systems, established virtual visiting protocols. Results: 0 cross-contamination incidents, 100% staff vaccination rate, maintained infection-free status for 6 months, positive CQC feedback, received commendation from management. Documentation and monitoring, daily infection control logs, staff training records, outbreak management reports, environmental cleaning schedules, PPE stock management, audit results, emergency response, 300 words. My emergency response competencies encompass both preventive planning and active crisis management. I've developed a comprehensive emergency preparedness system that has proven effective in various scenarios. Emergency response framework, preventive measures, weekly equipment checks, emergency supply inventory communication system testing staff, emergency role assignments, updated contact lists, evacuation route maintenance crisis management protocols, command structure implementation, resource allocation procedures, external agency coordination, family communication plans, documentation requirements, critical incident analysis, power outage response. During a severe weather-related power outage, I activated emergency generators, prioritized critical care equipment, coordinated temporary relocations, maintained medication schedules, managed staff deployment, communicated with families. Results: 0 adverse incidents, maintained essential services, 100% resident safety, positive feedback from families, CQC commendation, emergency training program development. I created a comprehensive training program including monthly scenario simulations, equipment competency assessments, first aid certification, fire safety training communication protocols, documentation requirements, evidence portfolio, emergency response logs, training attendance records, simulation feedback forms, equipment maintenance records, staff competency assessments. Point 5 Documentation and recording, 300 words. My approach to documentation emphasizes accuracy, accessibility, and efficiency while maintaining confidentiality and compliance with data protection regulations. Digital documentation system implementation, record management, electronic incident reporting, digital care plan updates, real-time accident logs, staff training records, equipment, maintenance tracking, risk assessment, documentation, quality assurance measures, double verification system, regular audit schedule, data protection compliance, access control protocols, backup procedures, archive management, innovation in recording practices. I developed a streamlined digital reporting system that Reduced documentation time by 30%, improved data accuracy, enhanced accessibility, strengthened confidentiality, facilitated trend analysis, supported CQC compliance case study, near miss, reporting, implementation of new reporting system resulted in 50% increase in near miss reporting, improved preventive measures, enhanced safety awareness, better risk management, reduced serious incidents, documentation training program, created comprehensive staff training covering legal requirements, data protection system navigation quality standards, audit procedures, confidentiality protocols. You will need to consider your own facility and carefully observe how the above applies. You may not have the opportunity to implement all of the above, but I am confident you have achieved 70%. You just need to think about your daily routine. 1.6 Staff Training and Development, 300 words. My commitment to staff development has resulted in a comprehensive training program that enhances safety awareness and competency across all levels of care delivery. Training program components: core safety training, manual handling certification, first aid qualifications, fire safety awareness, infection control protocols, risk assessment procedures, emergency response training, professional development, peer mentoring program, competency assessments, reflective practice sessions, skills workshops, update briefings, career progression planning, innovation in training delivery, developed blended learning approach, incorporating practical demonstrations, online modules, scenario-based learning, video tutorials, interactive workshops, assessment simulations, measurable outcomes, 50% reduction in workplace incidents, improved staff confidence, enhanced care quality, better CQC ratings, increased staff retention, positive feedback scores, peer-to-peer safety, mentoring program. Implementation resulted in knowledge sharing culture, reduced training costs, improved safety compliance, enhanced team cohesion, better learning retention, continuous improvement, evidence collection, training attendance records, competency assessments, feedback forms, incident reduction data, staff surveys, CQC inspection reports, professional reflection, 300 words. My experience in health and social care has deepened my understanding of the crucial relationship between safety management and quality care delivery. Key learning points: safety culture development, proactive risk management, continuous improvement, staff empowerment, resident involvement, family engagement, regulatory compliance leadership, impact, setting safety standards, leading by example, supporting staff development, managing change, building trust, maintaining motivation, critical success factors, clear communication channels, consistent policy application, regular training updates, stakeholder engagement, evidence-based practice, continuous evaluation, research participation, personal growth. Through this role, I've developed strategic thinking, problem-solving skills, leadership capabilities, communication expertise, change management abilities, professional resilience. This comprehensive approach to health, safety, and well-being demonstrates my commitment to excellence in care delivery and continuous professional development. Evidence portfolio references. Detailed documentation supporting all sections: risk assessments, RA001 to RA0050, infection control records, ICL 2024-Q1-Q4, training materials, TM HSW 2024-001 to 100, incident reports, IR 24-01-150, policy documents, PD HSW 2024-01-025, staff feedback forms, SF 2024-01-200, resident surveys, RS 2024-01-100, CQC inspection reports, CQC-202-4-Q1-Q4, audit results, AR-2 02 4-001-050. Professional Development Records, PDR-2 02 4-001-025. We will be looking at the laws and policies around this unit. Primary Legislation 1, Health and Safety at Work. Act 1974, Employer Duties, ensure staff and service user safety, provide safe working environment, conduct risk assessments, supply appropriate PPE, maintain equipment safety, employee duties, follow safety procedures, report hazards, use PPE correctly, cooperate with training, report incidents. 2. Management of Health and Safety at Work Regulations 1999. Key requirements: risk assessment, implementation, health surveillance provision, emergency procedures, safety training delivery, competent person appointment. 3. Control of substances, hazardous to health, KOSHH. 2002 core elements: hazardous substance assessment, exposure control measures, safety data sheets, maintenance, staff training requirements, health monitoring procedures. 4. Reporting of injuries, diseases, and dangerous occurrences. Regulations RIDDOR 2013. Reporting requirements. Work-related accidents, occupational diseases, dangerous occurrences, gas incidents, near-miss events. 5. Manual Handling Operations Regulations 1992. Key provisions: risk assessment duties, safe lifting procedures, equipment requirements, training obligations, review processes, essential policies. 1. Workplace safety policy requirements, fire safety procedures, first aid arrangements, accident reporting, emergency evacuation equipment maintenance. 2. Infection control policy core elements, hand hygiene protocols, PPE requirements, waste management cleaning schedules, outbreak procedures. 3-point stress management policy, key components, risk assessment support mechanisms, workload management training provision, review procedures. 4. Lone working policy, essential elements, risk assessment, communication procedures, emergency protocols, training requirements, equipment provision. 5. Violence and aggression, policy core requirements, prevention strategies, reporting procedures, staff support training provision, risk assessment. Remember to subscribe, like and share. DM or send an email for support.